Hey friends, today we are going to discuss about complications of cataract surgery. In this lecture, we are going to cover preoperative complications. After that, we are going to cover operative complications, then early post-operative complications, after that delayed post-operative complications, and at last we will going to discuss about IOL related complications. In this lecture, we will going throughout all the complications, but we will focus only on those complications which is important for your pre preparation or which is important for your examination point of view. So first one is preoperative complications, in which the first one is anxiety. It is occur due to the fear and apprehension of operation. So we can use the drugs like alprazolam or diazepam to alleviate such symptoms. The second one is irritative or allergic conjunctivitis. It may occur in some patient due to preoperative topical antibiotics drops. So it is occurred due to topical antibiotics. Then the third one is nausea and gastritis. Why there is a problem like nausea and gastritis to the patient? Yes, it is due to preoperative medicines such as acetazolamide, and it can be due to the medicines like glycerol. Antacid can usually relieve the symptoms. Then there can be complications due to local anesthesia. So there may be the complications like retrobulbar hemorrhage or perforation of the globe. And at last there can be corneal aberration. Why there is a corneal aberration? Due to use of tonometry. Okay, so how can we remember the preoperative complications? Yes, there is a simple mnemonic, that is ainak. What is ainak? Ainak, it is the Hindi term, and the meaning of ainak is mirror. So this is about preoperative complications. So A for anxiety, I for irritative or allergic conjunctivitis, N for nausea and gastritis, A for anesthesia, that is local anesthesia, and C for corneal aberration. So this is about preoperative complications. Okay, now we are going to discuss about operative complications. Operative complications are very easy to remember because we are going to relate it by steps of cataract surgery in step by steps. The first complication is superior rectus muscle laceration. Bridal suture is applied to hold the superior rectus muscle, and after that we are going to prepare for conjunctival flap, and during the preparation of the conjunctival flap there might be excessive bleeding can occur. So second one is excessive bleeding. The third one is incision related complication. Incision can be irregular, or due to the incision related complications there might be buttonholing of anterior wall of tunnel. Then there might be injury can be occur due to sharp tipped instruments such as keratome or a piece of razor blade. So there can be injury to the cornea, it can be to the iris or to the lens. In cornea, there may be Descemet detachment. In iris, it can cause iridodialysis. Then there is a complication which are related to anterior capsulorhexis, because first there is the anterior capsule. So there might be problem like escaping capsulorhexis, there might be small capsulorhexis, or there may be very large capsulorhexis, and which may be cause problems for the back placement of the intraocular lens. And remember that in eccentric capsulorhexis, which can lead to the problem for intraocular lens decentration at the later stages. So these are the problems due to anterior capsulorhexis. After the anterior capsule, there is a lens, and the complications which are related to the lens are nuclear drop in the vitreous cavity, or there can be posterior loss of lens fragments. After the lens, there is a posterior capsule and there can be posterior capsular rupture. After the posterior capsule, there is a vitreous and there may be vitreous loss. There can be zonular dehiscence and at last there is a choroid. Look over here. Here we have the choroid and there may be expulsive choroidal hemorrhage or there can be suprachoroidal hemorrhage. So first complication is superior rectus muscle laceration while holding the bridle suture. Then there is excessive bleeding. There can be incision related complications. After that, there may be injury to the cornea, iris or the lens. Then there is the anterior capsule and there is a complications which are related to the anterior capsular axis. Then there is a nuclear drop into the vitreous cavity or there can be posterior loss of the lens fragments. Then there is a posterior capsule and there can be posterior capsular rupture. After that there is a vitreous and there may be vitreous loss, then zonular dehiscence, and after that there can be expulsive choroidal hemorrhage and at last there can be suprachoroidal hemorrhage. Now we have post-operative complications and there can be early post-operative complications or there might be late operative complications. So in early post-operative complications there may be hyphema, that is collection of blood in anterior chamber. Then there can be iris prolapse, there might be striate keratopathy, there may be flat anterior chamber, there may be post-operative anterior uveitis, that is the inflammation of the uvea. Then there can be toxic anterior segment syndrome, and at last there can be bacterial endophthalmitis, that is suppurative inflammation of the eyeball. So we can remember it as FATIS. F for flat anterior chamber, E for bacterial endophthalmitis, T for toxic anterior segment syndrome, I for iris prolapse, S for striate keratopathy, and H for hyphema. So in which bacterial endophthalmitis, it is important for your examination point of view. So what is bacterial endophthalmitis? It is a suppurative inflammation of the eyeball. Look at this diagram. There is a inflammation of the eyeball. So endophthalmitis can be occur in acute onset or it can be occur in chronic onset. That is, it can occur in early complications and it can be occur in the late complications. Late complications means about the 6 weeks. So early complications occur most commonly due to the Staphylococcus epidermidis. Chronic complication is most commonly occur due to Propionibacterium acnes. Clinical features are pain, redness of the eye, hypopyon, that is pus in anterior chamber, and there may be yellowish exudate in the vitreous. The treatment of endophthalmitis, it can be divided into two parts, that is when the person is totally blind and there is a vision is present. So in blind person we can do the evisceration, that is removal of everything in the eye excepting sclera, and when there is a vision is present, can do the pars plana vitrectomy plus we will give intravitreal antibiotics like vancomycin and ceftazidime, and after that we can give the topical antibiotics. So this is about endophthalmitis. And in late complications there may be after cataract or we can call as secondary cataract. There may be pseudophakic bullous keratopathy, cystoid macular edema, there may be retinal detachment, endophthalmitis or epithelial ingrowth, and at last there may be complications like fibrous downgrowth. So how can we remember the late complications? Yes, it is very simple. That is A, B, C, D, E, F. Very simple mnemonic. A for after cataract, B for bullous keratopathy, that is pseudophakic bullous keratopathy, C for cystoid macular edema, D for detachment, that is retinal detachment, E for endophthalmitis and epithelial ingrowth, and F for fibrous downgrowth. So this is about early and late postoperative complications. And at last, we are going to discuss about intraocular lens related complications. So in which there may be malposition of the intraocular lens, there can be pupillary capture of the intraocular lens, or there might be toxic anterior segment syndrome. In malpositioning of the lens, there may be sunset syndrome or there can be sunrise syndrome. In sunset syndrome, look at this diagram. This is the lens and there is a inferior subluxation of the intraocular lens. Yes, we can easily locate this intraocular lens which is subluxate inferiorly. And in sunrise syndrome, there is a superior subluxation of the intraocular lens. Look at this diagram. There is a superior subluxation of the intraocular lens. And remember that UGH syndrome. What is UGH syndrome? U for uveitis, G for glaucoma, and H for hyphema. It is occur due to the rigid anterior chamber intraocular lens. It is occur due to rigid anterior chamber intraocular lens. And what is its treatment? The replacement of anterior chamber intraocular lens by posterior chamber intraocular lens. Remember this point because it is asked many times in the exams. The treatment is replacement of the anterior chamber IOL by posterior chamber IOL. Okay, so this is all about the complications of the cataract surgery, in which we first discuss about preoperative complications. After that, we discuss about operative complications. There is 12 points. And then we discuss about post-operative complications. There is a early and late, and we have the simple mnemonic, that is PETIS and ABCDEF. Both have 7 points. After that, we discuss about IOL related complications, in which malpositioning of the intraocular lens, pupillary capture of the intraocular lens, and toxic anterior segment syndrome. In malposition, there is sunset syndrome, sunrise syndrome, and remember about UGS syndrome. U for uveitis, G for glaucoma, and H for hyphema. And the treatment is replacement of anterior chamber IOL by posterior chamber IOL. So this is all about the complication of the cataract surgery. If you have any doubt regarding this lecture, you can shoot your comment below the comment section. Thank you for